this video, the Center for Teaching at the University of Veterinary Medicine Hanover will demonstrate the placement of a continuous subcuticular suture. This video will focus on the technique of the suture. When placing continuous sutures, a single thread is used to create a stitch across the entirety of the wound. For this, a beginning and ending knot are required for each suture. Continuous sutures have multiple advantages, such as a quicker application and an even wound adaptation. Furthermore, continuous sutures are gentler on the surrounding tissue. This, however, comes with the risk of the entire wound opening if only a single knot fails. Irregular wound shapes also make the placement of continuous sutures more difficult. When placing continuous sutures, the stitch should begin on the side of the suturing hand. The subcuticular suture is only utilized for the adaptation of skin lesions. This makes the pattern an alternative to simple interrupted sutures, especially useful for skin closure of wild animals, as the suture material can be absorbed after fully healing. The suture is both started and ended inside of the wound gap. Furthermore, this pattern creates little to no visible scarring. Needed for the Skills Lab exercise are a needle holder, a pair of surgical scissors, anatomical forceps, the suture pad, as well as gloves and a needle and thread combination. When placing the suture on a patient, absorbable suture material is used. The needle and thread combination contains an atraumatic needle without an eyelet. Instead, the thread is connected to the needle directly. This allows for a smoother perforation of the tissue when driving the needle, causing less of a reaction. Therefore, an atraumatic needle is better suited for finer and more fragile tissue, such as internal organs, blood vessels, or the skin. In contrast, traumatic needles are separate from their thread. The needle's eyelet must be threaded before use. This eyelet and thread create a double perforation of the tissue when the needle is driven through, creating a stronger reaction. Traumatic needles should only be used on more robust tissue, such as muscle or fascia. A few general notes for the procedure. This video focuses primarily on the suture technique. Therefore, there will be no mention of placement or number of knots, since these parameters are highly variable and depend on the species, the individual patient, as well as the state of the tissue itself, and if it is the beginning or end of the suture. When suturing, the needle is only ever held using instruments. It is vital that the needle's tip is never grasped, as this quickly leads to blunting. Furthermore, the thread should only ever be pulled on with fingers. No instruments are used for this. The needle holder with fixated needle is held in the dominant hand, with the remaining thread collected in the palm. When placing a subcuticular suture, it is vital that the suture is placed solely in the dermis. Different techniques can be used when placing the beginning stitch. In one technique, the needle runs perpendicular to the wound gap. The first stitch is driven through the dermis from the bottom up and on the opposite side from the top down, leaving the following knot on the lower edge of the dermis. In the second technique, a V-shaped perforation is placed parallel to the direction of the wound. The first stitch through the dermis runs in the direction of the wound angle, while the second stitch runs away from it. In this video, the second technique will be demonstrated. A right-handed suture will be demonstrated here, subsequently beginning on the right side of the wound. The beginning perforation is closed with a surgical knot. The rest of the beginning thread can be shortened to 1 scissors blade's width. The following suture pattern lies parallel to the wound gap. After each stitch, the needle is grasped with the forceps and fixated with its middle to lower third in the needle holder. The needle should be fixated in the position as it will be required in the next step. Before finishing the suture, it is important to leave a loop after tightening the final stitch, as this is required for the final knot. Finally, another V-shaped perforation is placed, similar to the suture's beginning. There are multiple types of knots which can be used for closing the suture. The first variant is a surgical knot, after which both the thread and loop are shortened to 1 scissors blade's width. Alternatively, the thread can also be buried. For this, only the loop is shortened to 1 scissors blade's width after placing the surgical knot. The needle is then driven from the inside out through the skin, the thread is tightened and shortened to the surface of the skin. For the last variant, an Aberdeen knot can be used. There is a separate video for the Aberdeen knot, which is linked at the end of this video and in the description. Finally, the suture is inspected for proper closure.